Hi, it's Dr. Christopher Maloney talking to you briefly about heart disease. Heart disease is one of those huge industries, and there's cardiologists and there's subsets of cardiologists, and it's really difficult to sound like you know anything because I'm not up on all the ejection fractions and things like that. But I'm going to say this about cardiovascular disease. The vast majority of cardiovascular disease is completely preventable. We know this. It's also reversible to some extent, and we've got the documentation on that as well. But it requires an involvement of the person to a much higher extent than the average conventional MD would expect from their patient. They really expect you to continue to eat burgers, they expect you to continue to eat badly, do whatever you need to do, do as minimal amount of exercise. And they've gotten tired of talking to you, so what they'll do is they'll start handing you the medications right off the bat because it's what works for them. But if you have any level of disagreement with what you're taking and how you're doing it, I really recommend asking for the starting point would be a registered dietitian and talking to that person. At this point, I believe Dean Ornish's program is often insurance reimbursable. If you look at his program, it's pretty involved, but basically what happened with his program was not that he had all these lifestyle changes, that he had support and he had continuing help for people to do the lifestyle changes and to stick with it. And if you do that, it's fairly easy to see that you would have a reversal and a downgrade of the level of danger you'd be in. And I really would encourage anybody to look at those programs, but also just to look, if you're having difficulty with your medication, it's not solving the problem, you're still short of breath, you're still having difficulty, to really look at having somebody else look at the whole thing. Your cardiologist is going to be really the expert in terms of managing those drugs, but that's what they're the expert on. For the most part, unless they've got a second degree, they're not going to spend an enormous amount of time looking at diet and lifestyle. And their diet advice may be just lose a few pounds. I'm like, no. You need to probably lose 40 to 60 to 80 pounds to really dramatically alter your triglycerides, your cholesterol levels, your LDL. And there's a lot of foods that you can take to actually move those numbers into a positive range. A lot of heart disease is not just the chronic buildup, it's actually an inflammatory model of the vessels. And the cholesterol in many cases is a side effect, buildup to kind of help protect the wall that's already being very inflamed. So it's that inflammatory marker model of heart disease that can really be turned around by changing the way you live.